Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and this is quite convenient for the study purpose. I hope you will make use of it. Now, today onwards, we will going to start another very important topic in Kaumarbritya, especially when you are dealing with the children and also you are dealing with Ayurveda medications. What I'm telling is about administration of Ayurveda medicines in children. Now, whenever we start the general practice or into the clinical practice, the first thing that appears in our mind is how to administer these Ayurveda preparations, especially in case of children. It may be Churna preparations, it may be Kvata preparation, it may be Asava preparations, or many other Ayurvedic mode of treatment which we usually do in adults. But same when it comes to the childhood practice, really there will be a challenge in administration of these medicines, because children are not ready to accept these medicines, which may be Katu, Tikta, Kashaya, sometimes Amla, or sometimes Lavana, or sometimes maybe Madura. So to understand all these problems and to get an idea how to tackle this problem, so I hope this particular presentation will going to help. Now, palatability of the medicine is the issue. Yes, really, the palatability of the medicine is the real issue when you start Ayurveda medications in children. The first thing that we should know is kids should not be treated as small adults. This is the first sentence usually we will tell in pediatrics, that kids are not the small adults. That means whatever all the preparations and method of administration of the drug that you follow in the adults cannot be given in half of the quantity to the children, because children are not the small adults. Children are children, they are kids. Their physical body is different, their mentality is different, their understanding is different, and their thinking is also different. So we should not treat that as small adults. Basti, if you are giving 200 ml for the adults, for the kids you give for 100 ml. No, it is not like that. So they should not be treated as small adults. Number two, definitely administration of the medicine is a big issue. If you are giving a medicine which is fortified with some of the Madura Rasa drugs also, then also it is very difficult to give the medicine to the children. That being the case, how you can administer these Kashaya preparations, Kvata preparations, having Kashaya, Katu, Tikta, Rasa, etc. So definitely it's a big issue, no doubt. But we have to tackle it. Anyway, Kshirapaka. Now, even Charaka very clearly says, Madurani, Kashayani, Kshiravanti, Mruduni cha. So how you have to administer medication to the children? There he says, the medicine should be Madurani, Kashayani, Kshiravanti, Mruduni cha. It should be Mrudu, it should be Madhura and Kashaya Rasa, and Kshiravanti, milk should be used as the medium. Okay, that means usually children will like the milk, so milk should be used as medium. Okay, so therefore Kshiravanti Mrudunicha, Madhurani Kashayani Kshiravanti Mrudunicha. That being the case, one of the preparation mentioned in Ayurveda, that is Kshirapaka preparation. So we can administer a lot of medication to the children for which they are reluctant to take in the form of the Kshirapaka. Okay, so that we will discuss later. Similarly, Avaleha preparations can be also quite easily given to the children. Panaka preparations, Mantha and Arka preparations. So these are also quite easy for administer in children. Now the main thing, whenever you are giving the medicine to the children, you have to mix it with the eatables. This is a very important thing. Don't try to give it plain mixing with the water, rather than mix with the eatables. Okay, just like Snehapana, we are giving Acha Snehapana and the Vicharana Sneha. So Vicharana Sneha is indicated for the children. Similarly, when you give the medicines also, try to mix it with some of the eatables. Okay, so churnas, many churnas are there. So many churna preparations are there, powder preparations. So that can be mixed with the chapati. Okay, when you are preparing the chapati, take some amount of the flour, wheat flour, and then mix the churnas and then you give it. Okay, by preparing the chapatis or roti, or it can be given mixed with the jaggery or madhu, etc. Okay, now even in the dosa preparation also, just like masala dosa what we are doing, so there you can mix some of the churna preparations, etc., and you can give it. Now kashaya preparations are quite difficult, no doubt. Okay, so we suppose patola katukaro inyadi kashaya we want to give. Okay, we know that it has got very good effect, but how to give it? Yes, dose also we will reduce, dose also we know, but how to give it? So then that time, instead of giving the kashaya preparations in the spoon, it is always better to use droppers. Okay, so in the droppers you take some 10 drops, etc., and give it frequently. So that is one of the best way. Okay, so kashaya preparations are quite difficult to give in spoon, etc., calculated way. Instead of that, if you use the droppers, only thing is you have to give it frequently, but you can give it, and it also gives good results. Now talking about arista asava preparations, the big question is whether arista and asava preparations can be given in the children or not. There are so many speculations about that. It should not be given, it should not be given. It's not like that. We are giving asava and arista preparations not for drinking purpose. We are giving for the medicinal purpose, so it has got a particular dose. I don't know why some of the physicians are very much bothered about asava preparations. If you give asava preparations, they will be habituated for it, alcoholic, and like that. So many speculations are there. It's totally wrong. Asava and arista preparations, they are the fermented medications, no doubt. Okay, fermented medications are very good for the intestinal bacterial flora. Okay, they act as probiotics, prebiotics, etc., and they have got its own benefits. Only thing is you have to give in a minimum quantity. Again, you can use the droppers. You can use the droppers. Take the droppers, and in drops you go and give it. So few people will say, physicians will have a speculation that it will cause gastritis. Few will say if you give asava preparations, child will be habituated for alcohol. So these are the myths. Okay, there is no value for this. Similarly, you can also prepare modaka and laddu preparations. Okay, so this can be also done by the modaka and laddu preparation. The medicine can be used as modaka, and medicine can be also used in the form of the laddu and given to the children. So many these medications which are related to the nutritional purpose, okay, PM, etc., protein energy malnutrition, failure to thrive, and nutritional malnutrition, etc. So usually we will give make preparation of these medicines in the form of the laddu. Okay, laddu or modaka, ashwagandha, shatavari, vidaragandha, vidarigandha, etc., balya preparation, jivani preparations, drugs. So they will be mixed together and prepared into the laddu form or the modaka form, then it is given. So many research is going on that. So another important part is administration of the medicines to the newborn and infant. Yes, when you want to administer the medicine, especially Ayurveda medicine for the newborn and infants, it is really a big challenge. But still it can be done, but still it is manageable. Infants, application of the medicine to the breast of the mother and made it suck. Okay, suppose any powder preparation, churna preparation you want to give, and make the paste of this churna preparation, apply it for the breast, over the breast of the mother, and then the child is allowed to suck the breast milk, and naturally the medicine will go enter inside, and this is one of the easiest way, and this is also mentioned by Kashyapa. Similarly, application of the medicine over the breast and then leave it for 48 minutes and then allow the baby to suck the breast milk is another important method. So we believe that the medicine which is applied over that will be absorbed into the breast milk, and when the baby is sucking the breast milk, and that will go inside the baby. Medications can be also given to the feeding mother many times. Okay, if you are not able to give the medicines directly to the child, you can give it to the feeding mother. Almost all the medicines given to the feeding mother pass through the breast milk. Amount can varies. Okay, so when you take the modern drugs, pharmacological drugs also, actually all the medicines will pass through the breast milk. There is no such things, and sometime the transportation through the breast milk, so that is very minimum, and sometimes it is maximum. For example, anti-tubercular drug and so many other anti-cancer drugs also it is taken by the mother, it do pass through the breast milk, but amount varies. Sometimes it is very, very negligible. Then we say it will not pass. Okay. So this is one of the methods. That means medication can be given to the feeding mother. If the child is suffering from constipation or some diarrhea, etc., you can actually give the medication to the mother also, and through the mother some amount of the medicine also pass through the breast milk into the body of the baby. So this can be also tried. These are the three methods. Now, rasa is considered as upadhatu of the stanya. Okay, that means stanya is upadhatu of rasa. So whatever food you give, that will be converted into rasa dhatu. Ahara is converted into rasa dhatu. So upadhatu of the rasa dhatu itself is stanya. Therefore, whatever you are taking, whatever mother is taking, definitely it is passing through the breast milk and enter into the body of the baby. Now, disease of the mother spread not through the breast milk, rather due to the close contact. Now, there is one more important concern. That is, if suppose mother is suffering from some cold, cough, fever, etc., diarrhea, etc., a mother should not feed the baby, because so through the breast milk it will enter inside the body of the baby. So this is one of the misunderstanding. See, of course, if the mother is suffering from cough, cold, and fever, it can spread to the baby, but not through the breast milk. It is by the direct contact or close contact, droplet infection, etc. Okay, so disease of the mother spread not through the breast milk, rather due to close contacts. Okay, so suppose diarrhea episode, the chance of spreading is very less. Mother is suffering from diarrhea, child is also suffering from diarrhea, no, less chance. But if the child is suffering from some of the infectious disorder, contamination disorder, and when the baby was brought very near to the breast milk, it is a very close contact, and definitely because of the direct contact, close contact, or droplet infection, the infection can spread to the mother. Otherwise, it is not possible. No any disease will spread through the breast milk. Okay, through the breast milk, the virus or bacteria cannot directly go inside. Only the antibodies and antibodies which is produced against that bacteria can pass through the breast milk to the baby, which is quite beneficial. Okay, so now intrauterine infections is through the intrauterine infections can spread to the baby, definitely when the baby is inside the womb. It is through the blood, not postnatally. Okay, it is also through the blood and not postnatally. Now, administration of the medicine, sometime even administration of the medicine can be given to the newborn or infant. Even Kashyapa also explains the indication of basti on the first day itself. Okay, sometimes the medicines can be also given to the newborn baby and as well as infant through the matra basti. Okay, by the matra basti method you can administer certain medications. Parectal administration of so many medication is also mentioned in the modern science, like paraldehyde and some of the parectal digiform, etc., is also mentioned in the modern pharmacology. Anyway, these are some of the methods that we can follow. Now in the next class, this is a basic. In the next class, we will see very important aspect related to this particular administration of the medicine in children. So that is ahara as medicine. So how wisely we can administer the medicines mixed with the ahara, or how we can modify ahara itself into medicines, especially in case of children. So that we will go to discuss in the next class. Thank you very much.